Welcome to today's video on the hidden warning signs of kidney failure that manifest in your feet. Right now, your feet are trying to communicate with you. They are sending crucial alerts about the health of your kidneys that could ultimately save your life, but the majority of people completely disregard these warnings. What if I were to tell you that the puffiness in your ankles, the pins and needles sensation in your toes, or even a relentless itch is actually a distress call from your kidneys? In this video, we are exposing 7 toxic indicators of kidney failure that show up in your feet, signs so discreet that they are occasionally overlooked even by medical professionals. More than 37 million Americans are currently living with chronic kidney disease, yet a staggering 9 out of 10 of them have no idea. They go about their lives entirely oblivious to the fact that their kidneys are gradually failing, holding the false belief that as long as they are urinating normally, everything is okay. Here's the terrifying truth: your kidneys can lose as much as 90% of their function before you start to feel genuinely ill. By that stage, it could be too late to undo the harm. This is precisely why your feet become your primary alert system. They serve as the canaries in the coal mine for your kidney health. A study published in the Journal of Tissue Viability uncovered something alarming. Patients with chronic kidney disease consistently display significant foot related problems that have a direct negative impact on their quality of life. This goes beyond mere comfort. It is a matter of survival. The very same blood vessels and nerves that ensure the health of your feet are deeply intertwined with the function of your kidneys. When your kidneys begin to struggle, your feet are among the first to suffer. Recognizing these links could be the key difference between detecting kidney disease early and ultimately facing dialysis or a transplant. However, there is something even more unsettling that most people are unaware of. The symptoms appearing in your feet are not just simple warnings, they are also predictors of how quickly your kidney disease is likely to advance. Each swollen ankle, each numb toe, and each change in your skin's color is telling you exactly how much time you have to take action. So pay close attention because your feet are on the verge of sharing secrets that could redefine the future of your health. All right, let's get into the list of hidden warning signs of kidney failure in your feet, starting with our first one. 1. Persistent foot and ankle swelling. You are likely familiar with that feeling at the end of a long day when you remove your shoes and see that your feet seem puffy. Most people attribute this to prolonged standing or consuming too much salt. But what if that swelling is, in fact, your kidneys sending you a critical distress signal? Edema, the clinical term for this type of swelling, happens when your kidneys are no longer able to adequately filter surplus fluid and sodium from your bloodstream. Research from the American Kidney Fund indicates that kidney related edema typically manifests first in the feet and ankles, largely due to the effect of gravity on fluid retention. Your kidneys are designed to maintain a precise balance between the fluid you take in and the fluid you excrete. When kidney disease sets in, this equilibrium is shattered. Sodium begins to build up in your blood, which compels your body to hold on to water in an effort to dilute the excess salt. This extra fluid must go somewhere, and it often collects in the lowest points of your body, your feet and ankles. What makes kidney related foot swelling particularly alarming is its unrelenting nature. Unlike the swelling caused by an injury or a temporary high salt meal, edema from kidney disease does not vanish overnight. It gets progressively worse, eventually creating what is known as pitting edema. When you press your finger firmly into the swollen area, it leaves an indentation that lingers for several seconds. This is more than just uncomfortable. It is a clear sign that your kidney function has already significantly diminished. 2. Numbness and tingling in feet. This is where kidney disease takes on a truly insidious character. It launches an assault on your nervous system in ways that most people would never associate with a kidney issue. Uremic neuropathy is a condition that affects between 60% and 100% of patients with advanced kidney disease, according to research published in the Brazilian Journal of Medical and Biological Research. When your kidneys can no longer filter toxins effectively, these waste products accumulate in your bloodstream and begin to poison your nerves. The process starts very subtly. You might experience an occasional tingling in your toes or perhaps a mild burning sensation in your feet at night. Many people dismiss these symptoms as just a part of aging or incorrectly attribute them to diabetes. What is actually occurring is that uremic toxins are methodically stripping away the protective sheath around your nerve fibers, beginning with the longest nerves in your body, the ones that extend all the way to your feet. Studies utilizing nerve conduction tests have revealed that 70% of patients with chronic kidney disease show signs of peripheral neuropathy even when they have not reported any symptoms. This silent neuropathy is especially dangerous because it diminishes your ability to feel injuries. Imagine stepping on something sharp or developing a pressure sore without ever realizing it happened. Without proper sensation, these seemingly minor injuries can escalate into life threatening infections. 3. Chronic foot pain and gout attacks. Your kidney's role extends far beyond simply filtering waste. They are the master regulators of your bone health. As kidney disease progresses, it sets off a series of hormonal changes that effectively steal strength from your bones, leading to a condition known as renal osteodystrophy. This bone disease impacts up to 90% of patients with advanced kidney failure and frequently presents as persistent pain in the feet. Research detailed in the KDIGO clinical practice guidelines shows that kidney disease interferes with your body's capacity to metabolize calcium, phosphorus, and vitamin D. Your failing kidneys are unable to convert vitamin D into its active form, which results in a calcium deficiency. To compensate for this, your parathyroid glands shift into overdrive, extracting calcium directly from your bones to maintain stable levels in the blood. The consequence is that your bones become weak, brittle, and painful, particularly in weight bearing areas like your feet. But there is another mechanism that makes foot pain even more sinister for individuals with kidney disease. Your kidneys are tasked with filtering uric acid out of your blood. When their function decreases, uric acid builds up, forming razor sharp crystals that settle in your joints. This leads to gout, and the first joint typically affected is the big toe, causing debilitating pain that can make walking nearly impossible. 4. Skin color changes in feet. Now we come to what is perhaps the most visually alarming warning sign: changes in the skin color of your feet that expose the hidden battle taking place within your blood vessels. Chronic kidney disease, along with the conditions that often cause it, like diabetes and high blood pressure, launches a destructive assault on your circulation that becomes visible in your feet long before you feel ill. The very same vascular disease that harms the filtering units in your kidneys also wreaks havoc on the blood vessels in your feet. Research has shown that peripheral arterial disease is present in up to 40% of patients with chronic kidney disease, which leads to a range of color changes that narrate the story of your circulatory system's failure. Inadequate arterial circulation can cause your feet to look pale or white, whereas poor venous return may result in a dark, ruddy coloration. When circulation becomes severely restricted, your toes might turn blue, a clear indication that oxygen delivery has dropped to a critically low level. This is not just a cosmetic concern, it is a medical emergency signaling that tissue death is about to occur. If circulation continues to worsen, parts of your feet may turn black, which signifies gangrene that will necessitate amputation in order to save your life. But these color changes are not solely due to circulation issues. Kidney disease also impacts your skin through a process known as hyperpigmentation. 5. Severe itching of feet and ankles. Imagine an itch so persistent that it robs you of sleep at night, so unrelenting that you scratch until your skin bleeds, and so maddening that some patients find it even worse than pain. This is uremic pruritus, a form of itching related to kidney failure that affects as many as 90% of patients with advanced kidney disease. Your feet, with their thicker skin and constant enclosure in shoes and socks, often bear the full force of this torment. When your kidneys are no longer able to properly filter phosphorus, this mineral accumulates in your blood and gets deposited in your skin. Elevated phosphorus levels set off inflammatory responses that lead to intense itching, especially in areas with thicker skin such as your feet and ankles. The itching typically intensifies at night and following dialysis treatments, which creates a destructive cycle of scratching that results in skin damage and infection. But phosphorus is not the sole cause. Research published in numerous nephrology journals has demonstrated that uremic toxins, the waste products that healthy kidneys would normally filter out, build up in your skin and activate the nerve endings responsible for the sensation of itchiness. These toxins effectively poison your skin from the inside out, generating an itch that no amount of scratching can ever fully satisfy. 6. Restless leg syndrome. Just when you thought kidney disease couldn't possibly make life more difficult, restless leg syndrome, RLS, enters the picture. It is a neurological ordeal that impacts up to 60% of patients with advanced kidney disease. This condition is not just a feeling of restlessness, it is an overwhelming, irresistible compulsion to move your legs and feet, particularly at night when you are trying to sleep. The precise mechanism behind kidney disease related RLS is not entirely clear, but research indicates that it is linked to the buildup of uremic toxins that interfere with neurotransmitter function in the brain. These toxins disrupt the delicate balance of dopamine and other chemicals responsible for controlling movement, which leads to sensations that patients describe as crawling, burning, or like electric shocks in their feet and legs. The timing of RLS and kidney disease is especially cruel. Symptoms tend to worsen in the evening and at night, exactly when your body requires rest to recover from the stress of the disease. The constant need to move your legs makes sleep impossible, which triggers a host of other problems, including fatigue, depression, and potentially a worsening of kidney function due to inadequate recovery. What sets kidney disease related RLS apart from other causes is its severity and its resistance to conventional treatments. Standard medications often prove less effective in kidney disease patients. 7. Poor wound healing on feet. The seventh, and perhaps the most perilous warning sign, is the inability of your feet to heal from even minor injuries. This represents the convergence of all the preceding issues: poor circulation, nerve damage, a compromised immune system, and an altered metabolism, all coming together to create a perfect storm for devastating complications. In a healthy person, small cuts, scrapes, and pressure sores typically heal within a matter of days to weeks. For a patient with kidney disease, however, these same minor injuries can escalate into life threatening ulcers. Research clearly shows that patients with chronic kidney disease have significantly compromised wound healing abilities due to a variety of factors, including reduced growth factor production, altered collagen synthesis, and a weakened immune response. The process often starts with a minor injury that goes unnoticed because of neuropathy. Without the ability to feel the injury, patients do not protect the affected area, which leads to repeated trauma. Poor circulation means that not enough oxygen and nutrients can reach the healing tissue, while the high blood sugar levels often seen in diabetic kidney disease patients create an environment where bacteria can flourish. The statistics are stark. Foot ulcers develop in approximately 25% of chronic kidney disease patients, and these ulcers have a 50% likelihood of becoming infected. Your feet are speaking. Are you paying attention? These 7 warning signs: persistent swelling, numbness and tingling, bone pain and gout, changes in skin color, intense itching, restless leg syndrome, and poor wound healing are your kidneys' desperate attempts to communicate their declining health through your feet. Each of these symptoms corresponds to a different aspect of failing kidney function, from fluid regulation to the elimination of toxins and bone metabolism. The tragedy is that by the time these symptoms become prominent, significant kidney damage has already taken place. However, early recognition and intervention can still make a profound difference. Research consistently demonstrates that patients who begin treatment for kidney disease in its early stages can slow or even stop the progression of the disease, in many cases avoiding the need for dialysis and transplantation. If you are experiencing any combination of these symptoms, do not hesitate. Make an appointment with your healthcare provider immediately. Simple blood and urine tests can detect kidney disease years before you begin to feel sick. Early detection provides you with options: dietary adjustments, medications, and lifestyle changes that can help preserve your kidney function and prevent the devastating complications we have discussed. If this video was helpful, please type yes in the comments. This encourages us to create more content like this. Don't forget to like this video if it offered valuable insights. Share it with family and friends who need to know these warning signs, and subscribe to our channel for more life-saving health information.